I'm Claire Sutherland. I'm Associate Director for Advanced Practice in Derby, Associate Postgraduate Dean for Interprofessional Learning within East Midlands Postgrad Medical and Dental Education.
Gemma Baker, Advanced Clinical Practitioner at Gloucestershire Hospitals.
Hi, my name is Nick Worth. I'm an MSK Physio by background, but I'm the North West Faculty for Advancing Practice Regional Supervision and Assessment Lead.
My name is Dolly McPherson and I'm an RChem credentialed Advanced Clinical Practitioner.
My name is Martin Trudell and I'm an Advanced Physiotherapist Practitioner working in the Emergency Department.
Rachel Hosniak, Advanced Clinical Lead in Frailty.
Deborah Harding, Professor at St George's University of London and Subject Matter Expert Multi-Professional Supervision at Health Education England.
Acknowledge that others see qualities in you that you might not always see yourself. It doesn't make you fraudulent. It doesn't mean that you're disguising those skills. People are looking at your results.
It's not just you. Every single person that you have worked with or your role models over the years have had the same feeling at some point.
With hindsight in situations of imposter syndrome, I would say that actually knowing that you're able to do your job properly and that what you're able to do is you're able to turn people's opinion around and give yourself confidence by doing a good job, by getting the basics right, knowing what your strengths are and just working within them.
After about an hour, I plucked up the courage to say that we'd been meeting for all that time and as yet hadn't spoken about patients or the public. And after what seemed like a really long pause, but in reality probably wasn't that long, I noticed other people in the room starting to nod and agree that we probably needed to pay some attention to that. For me, that's a really good example of when I'm feeling that out of depth feeling that I need to pay attention to the fact that I probably do have something to contribute, but it's working out how to do that in a novel and unfamiliar environment.
Recognise that it's okay. It's quite normal. We all experience it. And to acknowledge that's probably the first step. Once you've acknowledged it, you can feel a bit more comfortable with the way you feel, understand the way you feel. And there's always plenty of us who've experienced it before you. So I think the next best step then is to have a chat with someone who may have been in a similar position to you.
Recognise the value that you add to the multidisciplinary team.
Share the fear with a respected friend or colleague and go in with one achievable goal and one thing to learn.
This feeling probably means you're just about to develop and learn something new.
All those times that you make that spot on decision, when someone says well done, when someone says thank you, evidence it, because you can't argue with physical evidence of other people telling you that you are good at what you do.
Focus on yourself, not necessarily focus on the environment around you, and realise that actually, you have ability, you have the capability within yourself, and work to just do the things you know you can do and you're good at on a regular basis. Get those basics right, and then what people will do will recognise your ability and therefore will actually trust you and give you that sense of confidence.
The advice I would pass on to others is to have confidence and faith in the contribution you can make and to work out ways in which you might do that in environments that are less familiar and more novel.
I've found the most empowering thing is to be willing to admit the things that you don't know. Take the power away from that fear of being exposed and create a growth mindset.
So my top tip would be to embrace that and turn that feeling into excitement about what it is you might just be about to learn.
I think I would say to myself that actually you're very welcome. You were employed because you were capable, and this was your interpretation of what was happening, not those around you. And actually they were very excited to have me as part of the team. And just remembering that sometimes the way you see things isn't always the way others do.
Be confident in your abilities.
You're not alone. There are lots of brilliant people out there who have experienced imposter syndrome.